So please, Dr. Wennberg, can you start?
Please go ahead. I just want to say that it's nice to see that so many has joined this seminar, and we are really looking forward to this year's monitoring exercise, and we think it is especially important, though, to the 5-year evaluation coming up. So please go ahead, José.
Okay, thank you very much, Dr. Wennberg. Well, as you probably know from previous webinars, that is our presentation. Dr. Wennberg works at Karolinska University Hospital, and I work at La Paz Hospital in Madrid. And we have been working on the quality and safety working group during the 5 first years of the network. And now in this period we are on, that is called the bridging period, we are in charge of the evaluation working group. Okay, and as Dr. Wennberg said, these are the key points of this meeting. Monitoring is not new on this network and in all the reference networks. It started at the end of 2018. We did our first monitoring exercise at February 2019. And since then, we have done several surveys collecting key activities for the network, not only at the network level, or not only at the information that at the coordination center we may have, but also, and that's very important, of the information that you have at your local level, at your healthcare provider level. Last survey took place last February 2022. We collected the full year to 2021, and now, well, as mentioned before, we want to repeat that same scheme. We want to keep it simple, and now we want to collect information for the full year 2022. And as we did last year, not only the initial members are participating, but also the new full members and also the affiliated partners. So we expect all of you to be active in the monitoring exercise. And as you may already know, DG Santé, the European Commission, also asked from us, what is your responsiveness? What is your participation in the network activities? And that is also registered. As Dr. Wennberg said, we are now also in a very special moment of the networks, not only because we are in the process of starting another cycle that will start from August 2023, but also because we are in the middle of the evaluation of the first 5 years of the network. And in that evaluation, this monitoring exercise is going to have an important role. So we have to think that what we are launching today is something that it will be evaluated in the near future. Know that, as we have talked in previous webinars, we have to register, we have to be able to collect our activities at network level, because we have to demonstrate which is the value that the European reference networks add in our European member states.
I agree with you, José, and I think that's very important that we can show the activities at the different healthcare providers and the different members of the network, because that will be one very important point when the Commission looks into our the future of the European reference networks.
That's right. That's the idea, and perhaps you already know our history, but we thought that it will be interesting to show a panorama of what the networks and TransplantChild has been in the last few years. No, as you may know, especially the initial members who applied in 2016 to be members of the initial networks. Well, that started some years ago. This first 5-year period started in Vilnius, Lithuania, in March 2017. And well, as you can see in the slide, well, we had a new call for joining affiliated partners and new full members in 2019, but as you also, of course, know, we also have the pandemic. And that happened all these 5 last years. And last year, as I mentioned at the beginning, it was an important milestone for all the networks. No, we finished this 5 years period at February last year. We launched at the same time the operational areas that you may know that we want to be a big point, so we can get more to get more teamwork to reach and to give more support to the members of our network. No, and as I mentioned before, we are now in a bridging grant that started last March and that will finish next August. So we are expecting from August and ahead a new period for all the networks that we don't know yet the details. As you can see, in all this time, the monitoring has been a key milestone, but also the clinical patient management system, the board of the network meetings, the clinical practice guidelines activities we have developed, the clinical audits that has been very active in our network, and also the development and the pilot of the Peter registry that we are, as you know, pushing forward also in the network. As you see now, and Dr. Wennberg mentioned, very recently, all the initial members of all the networks have received a message from the European Commission, because the evaluation process of the first 5 years has already started. And all these original full members, in our case, we were 18, but United Kingdom had Brexit, so we are 17 initial full members. All the initial full members are now collecting information for this evaluation process, and in this information we are collecting, and as we mentioned, we are also supporting from the structures of the network. The monitoring is a point that is going to be key in the evaluation process. So that is, as I mentioned, a panorama. This is what the future of the monitoring exercises will look like. This was the AMEQUIS, that is assessment monitoring quality system that the European Commission is going to put on in the near future, and that will try to get more information about the activities that the networks are developing, and it will take information not only from the coordinators, and not only for the healthcare providers, but also in the near future, member states will also report information on the activity of the network members, and also patient representatives. That's going to be the future. But for now, we are still working with the original set of core indicators that all the networks have in common, and that they also cover activities in all the areas that we develop in the network. So that is our reference, and that hasn't changed since last year. So the idea is that this year survey, this year questionnaire, is quite similar from the previous one. And for those of you who participated in last year, we expect that it will be easier. We have done some improvements to that, but we will get to that very soon. Only to remind you that these are the indicators that are common to all the networks, and that apart from education training activities, clinical trials, observational prospective studies, accepted peer-reviewed publications, and clinical practice guidelines or other clinical decision-making tools, or the activities we have done to present the network in congresses, conferences, or meetings, or the visits to the website, we want to stress out that the main information point, and that we need your participation, your active participation, in order not only to put forward these activities, but to get this information, are the new patients that are referred to every healthcare provider in the scope of every network, and the CPMS activity. And that is something that we have been focusing on the last years in TransplantChild. The idea is that we have to, little by little, to be able to extract information not only on the activities in our case, the activities of our transplantation programs, but also on the patients that we attend previous to the transplantation or post-transplantation. That's as the scope of the networks are reflected, that it's very valuable for all the networks, that we keep a record of the number of new patients that we attend and that fall within the scope of every ERN. As I mentioned, we have been asking for this information in the last surveys, and this year we will keep on doing that. Okay, so please feel free if you don't understand what exactly these new patients, but as I mentioned, it's something that we have to improve because our experience show us that it's not always easy to extract this type of information, at least in an easy way, in an accessible way.
That is one advice that I can give from my personal experience with these monitoring exercises, that it takes some work and time to find this data, at least at my center. So that could be one good advice, to not wait until the last minute with this. And also, if there's any point that is difficult to understand what data that is asked for, please contact any one of us or the area manager or something, so we can help you.
That's the idea. That's the idea about doing this year the webinar in January. Last year we did it in February because, as I mentioned, some of you may know last year questionnaire, but for some of you this will be new. So we want you to give this information in advance so you can identify from where you can obtain this data. And we know some of them is not easy to obtain. So that's something that we want you to look for in advance. Only a figure that tries to express that in TransplantChild, we are interested in the whole process, not only in the transplantation, but also in the activities we do with the patients before transplantations and the activities we do with the patients after transplantation. As we focus on pediatric transplantations, probably the scenario we will have is that at some point the patient will reach adult age, so it will go to an adult setting. But since then, we will have the possibility to attend it in our healthcare provider. And that is something that we want to stress positively, to put it into value, into a good as a strength for us. Well, as I mentioned, that's only a scheme, and as Dr. Wennberg said, there's some information that comes from the core indicators that that are asked to all the networks, but in our case, we also ask for some specific indicators. For example, the type of transplantation programs you develop. As you already know, now we have a big number of centers participating in the network, and not all the centers develop the same transplantation programs. Some of them are solid, some of them are combined, some of them are even stem cell transplantations together with solid organ transplantations, and that's something that we think is one of the strengths of our network. So we want every possible transplantation program that is active in your center to be active on TransplantChild, and that is some information we ask from you every year, because we know that can change year to year, and that is something we ask every year. So we will ask you the information of the transplantation programs we know are active in your center, the number of the transplantation performed, well, not in this case, but we have talked about in some time to get information about the hospital stay, the visits, the patient attended, the patients active, that's what we are talking about, new patients. And also something that we have been asking from the beginning of the monitoring exercises is the survival rate. We also ask about the participation in exchange programs, the participation in research consortiums, the quality certifications, or in this case, this is new this year, we want also to provide, if you have that information locally, some activities you have carried out with patients or specific material that you have developed for patients at healthcare provider level. As I mentioned, these are specific indicators, and what we have done this year is that we have simplified the questionnaire in a way that we will send every healthcare provider a specific questionnaire, because as you may know, we have been together with the managers of the operational areas, we have been refining the information about the transplantation programs that are active in your centers. So the idea is that you get the questionnaire with the answers related to the transplantation programs that you have told us that are active. We think that is easier for you to answer, because in previous exercises we gave you all the possible transplantation programs, and for some of you, especially those of you who don't have many transplantation programs, that we thought that could be, or that was difficult. So that is some change that we have done this year. This is the look of this year monitoring survey. As you can see at the beginning, we ask you to put in your full name and your email account, and to also specify your healthcare provider. This survey is sent to the representative and the second representative that every healthcare provider have given us. So what we expect from you is that if you have several transplantation programs in your center, that you're able to contact the people responsible for those transplantation programs. So only one person, as is possible, can fill up this survey, and not every person separately. But as I mentioned, that's something that you can also ask us if it's difficult for you. This is again a summary of the information we are asking from you in this year exercise. As I mentioned, is the same we asked last year. We will ask about transplantation activity in the whole year 2022, the new patients included in the transplantation programs, the active patients, the survival, not only for solid organ transplantation, but also for stem cell transplantation programs, and those additional activities with acknowledgement of TransplantChild. That's very important. As you may know from previous monitoring exercises, if we do, for example, a presentation at a conference, or we prepare a publication, if we want that publication to be accounted for transplantation, there has to be an acknowledgement of the network. If you don't know how to do that, please ask us or ask the technical secretariat, because there are specific rules and documents about how to do this correctly. And again, we ask about other indicators that we think that it will help us not only because, as you know, we have some activities that we collect at a coordination level, but we think that you may have other activities that can be valuable for the network. This is probably the slide that we were expecting. The idea is that next Monday, the 23rd, that's not right, of January, we will send to all the full members and affiliated partners, as I mentioned before, an individual link to your survey, to your questionnaire, and we will try. I mean, we think that in 5 weeks, that's enough time to have this data collected Okay, so the idea is that we finish the survey. We expect you to have fulfilled the survey at the Monday, the 27th of February. As I mentioned, if you give us information about additional activities that you have undertaken and that can be of interest to TransplantChild, we expect you to have data or evidence about that activities. And as I mentioned before, and it's here in this slide, this year you will have individual links. So as I mentioned, the questionnaires will be more simple than last year. As I mentioned at the beginning, it's an obligation. If you want to be a member of the ERNs, you have to provide these results in this monitoring exercise, because as I mentioned before, the participation is registered, and this participation is going to be asked for the original members in this evaluation that is starting now. As you also will probably know from previous monitoring exercise, we will validate the results that we have collected, and we will do it through specific webinars, or in some cases we have done it in the Board of the Network meetings. As we probably know, next Board of the Network meeting will take place in May in Warsaw, and well, we think that's a good opportunity to get together and to validate the data we have gathered from all of us. And as a summary, and I'm about to finish, so you have time for your questions or your suggestions. We expect to collect in this fifth annual survey the activity of 2022. That's not right, it's 2022. We have simplified the questionnaires. We hope that will make easier for you to answer them. Participation is compulsory. We expect operational areas, as Dr. Wennberg said, to provide support in this task. And as also we have mentioned during the presentation, we have now this evaluation of the first 5 years, and to prove the importance of this monitoring exercise, they have asked us for the participation of all the original full members in the monitoring exercises we have done since last year. So that's something that we have to keep that in mind. And just to finish, of course, we think it's a big effort for all of us to do this exercise, but we think it will make it easier that we haven't changed the questionnaire practically at all from last year. We have to give a minimum report of our activity in order to have, as I mentioned before, an added value of as a network in the European Union. As Dr. Wennberg said, please get prepared and collect that information. Ask for that information as soon as possible. 27th of February may look as a very far date, but it's not so far. And well, if you provide extra data, please have evidence in case we need to access it. And as we mentioned, we can add value. We can add value if we work together. And the monitoring exercise is a good opportunity to make that possible. Thank you very much for your attendance. And Dr. Wennberg, if you want to add something else before
thank you, José. As always, a very good and clear presentation, and we all have understood the importance of this and the time that we need to put in. So please, any questions, and we will try to answer them. And one thing, if you have, I think the most questions will come when you look at the monitoring survey, and you can actually see the questions. So that is when the most questions will come, and please direct them to the operational area managers or to the central coordinator in Madrid.